of the day, my name is Lisa Marino, and I figured I would just give you a short snippet, what I think would be tremendously valuable for the FFMA conference coming up here in April. When we talk about ending the monopoly, what we're seeing with employers that we have to provide a tremendously valuable experience, we have to provide a tremendously valuable return on investment, and the best way to do that is to provide proactive, predictive, and preventative care for our employees and building that into the health plan. So what does that look like, and what do I think our next level of care needs to be? Because this is what our even business owners are listening to. This is what employees are listening to on Joe Rogan, from Brigham Bueller, from Tucker Carlson. They're hearing about these predictive types of testing, and they're calling and they're asking about this, and they're wanting this information. And this is how we get to end this monopoly, provide these next level type of benefits, and really shine head and shoulders above the competition that's out there in the marketplace right now. So fasting insulin, as we know, can predict diabetes 10 years before the standard of care. And this is tremendously important because we know that diabetes is typically one of the, if not the highest, most common health conditions within a health plan, within a health system. Currently, the monopoly does not pay for any sort of care until that diabetes diagnosis. And we all know that we should be, and we could have been predicting, and we could have been seeing that train wreck coming before it happened. And so we want to be advocating for our patients in this way. We want to be advocating for this to be built into our health plans this way. This is a tremendously inexpensive lab to be doing is fasting insulin. Now, if we take that a next step further, and we're talking about kiddos, if we have this insulin resistance problem by the age of 9, children are 5 times more likely to be schizophrenic or have bipolar disorder. This metabolic issue is just far-reaching, conditions that we thought were just genetic. And so are we using this type of predictive analysis to understand where our patients are heading and show this kind of value to our families? Because we all know these medications are high cost, and we want to try to prevent that as much as possible. The other big one is low back pain or pain in general. And what we do in our health plans is patients have access to $0 physical therapy and occupational therapy, because it is the greatest cause of workplace injuries is body mechanics. So I want to advocate for our members to be going out and to how am I observing my patients? Are we doing some sort of interaction in the community with other physical therapists, occupational therapists? How are we getting out and watching them and how they're working and how they're moving and being proactive that way? We like to use education pieces like this where it kind of shows the positioning. Sitting and leaning is the worst type of position. So how are we talking to even our administrative staff that are we using sit to stand desks? Are we taking regular breaks? How are we working through that to provide even more value for our employers? And being predictive is another one. Attention deficit disorder. We see this gap of we should be getting like a ratio of omega-6s of 4 to 1. Okay, omega-6 is coming from things like peanut butter and processed foods that we get a lot of, and versus your fatty fishes, good oils, good healthy nuts. And we're seeing it more like a 20 to 1 ratio, and how this is impacting our kiddos and our brain health as well. Something that is also easily tested for. We take that a step further with adults. If we understand their omega-3, their vitamin D, and their exercise levels, cancer risk goes down 63%. This is something that should be in every single physician's back pocket. All of us should be testing for these simple, inexpensive things. A vitamin D test is $22, yet we had a health insurance agent that was trying to use his own health plan that he thought was amazing, and they still wanted to charge him $400 for vitamin D. And so we need to, again, end that monopoly, go straight to using cash pay pricing for something that is cheap and inexpensive to provide so much value. COVID deaths, so just keep going. COVID deaths were 0. There were no COVID deaths. The vitamin D levels were in the 60 to 80 range. And a typical lab is only going to say like 30 to 40 is normal. Then we get into dementia, and I have it on both sides of my family, and I'll be 35 next year. So I'm already looking at triglycerides, cholesterol, and blood glucose as, this is specifically HDL cholesterol, as a predictor of dementia later in life. So this is a really important tool to be taking to employees and employers and showing them that we can start to see those risks that's important to understand your blood labs as well. This gets into a little bit more specific details, but we're seeing behavioral disorders, things like high oxalates are easy to test for, quinoleic acid we can test for. We all know about candida, yeast, and mold that can be tested for. And so these are types of things that we get a little bit more advanced, but what is actually possible and what we know that something like 70% of employees want to have more holistic healthcare. And so do we have in our communities, are we learning about this? Are we starting to find ways to bring this to the table in our health plans? Being preventative, I would go into this a little bit more specifically, but we should be using more predictive data, as I talked about with insulin and omegas, additionally vitamin D, magnesium, B vitamins, looking at brain health, whole health, and kiddos. And then a more exhaustive panel for adults as well. And then when we talk about being preventative, this study just came out we talk about being preventative. This study looked at primary care and depression management and how it saved over a 2-year course 10 days in absenteeism from those that are interacting with primary care system, and how important that is for employers. So they were actually able to put a dollar amount on that. This is something that we need to bring out to our employers, is saying just in depression management alone, it can save over $2,000 per employee. This gets a little bit more specific, but it is an easy test for providers to do. Food sensitivity, an example of wheat zoomer, you can do corn, soy zoomers as well. But this was when we looked at cow's milk versus like beta casein, and knowing exactly what specifics could be interacting with children, things like immunoglobulins. Anti-zonulin is the one that we test for, leaky gut, and to know if those tight junctions in the gut liner and gut barrier are closed well or not. So we're getting into more advanced, but we need to stay at the forefront, and I want to keep this on everybody's radar going forward if we expect to provide the best health plans, the best patient experience, and the best outcomes.